I'm Dr. Mohit Kumar Arora. I'm working as a pediatric orthopedic surgeon in Narayana Super Speciality Hospital. Today in this video, I'll be talking about rigid flat foot. So, normally our foot has got two arches, medial longitudinal arch and transverse arch, which I have already discussed in my previous video. In case of rigid flat foot, the medial longitudinal arch is permanently collapsed. That means that the arch will not be there whether the child is standing on his toes or walking or running. Hence, this is a more serious condition than flexible flat foot. The management of the rigid flat foot depends on the cause. Now, we can discuss the causes of the rigid flat foot. Number one, tarsal collision. There are small bones present in our foot which we call tarsal bone. Sometimes they remain fused to one another since birth. This gives rise to a condition called tarsal collision, which leads to rigid flat foot. Normally, these children are asymptomatic in 75% of the cases, and this tarsal collision condition is diagnosed incidentally on X-rays or CT scan. However, symptomatic case might need shoe inserts in the form of medial arch support, or if the problem still persists, they might need surgery where we remove the fused bone and replace it with muscle or fat. The other cause of flat foot is congenital vertical talus. It is basically a irreducible dorsal dislocation of the navicular over talus. In this, the foot breaks at the middle, and we call this as a rocker bottom foot, just like the base of a rocker bottom chair. This is usually present at the time of birth and needs serial plaster application. Usually it gets treated with serial plaster application. However, if still some deformity persists, then the child might need corrective surgery. The other cause of rigid flat foot is accessory navicular bone. This is basically a small piece of bone which remains unfused to the larger piece which we call as navicular bone. This gives rise to rigid flat foot. The treatment is the same. We observe. If symptomatic, we give shoe insert, and if the problem still persists, then we may need to excise the bone. So basically, rigid foot is which demands further investigation, and usually it persists after the age of 10 years. It requires treatment and a pediatric orthopedic surgeon's opinion, and the treatment depends on the cause found, which I have discussed in the causes respectively.